Thanks so much, Roland. 60s, love to hear it. Well, moving on. Sunday marks 2 years since Idaho's first case of COVID-19. CBS 2's Marcos Guadarrama reports on the lessons we've learned and what the future could look like.
Well, I spoke with St. Luke's doctor today, and we talked about how COVID has changed our healthcare system and what the term endemic really means and where we go from here now that cases are once again going down in the state. Over the last 2 years, the pandemic has impacted our healthcare system and uprooted many lives. St. Luke's doctor Jim Souza reflected on the challenges it's created for healthcare systems.
We've learned how important primary care and access to healthcare is because we're managing now almost 2 years of progressively pent-up demand due to these waves and our inability to manage elective care and routine care.
As coronavirus restrictions loosen up around the state and across the country, I asked Dr. Souza what happens next.
The honest answer is if anybody tells you that they know the answer to that, you should really ask whether or not you should believe them, because honestly, we don't know.
As more Americans ease back into their normal lives, I asked whether we would likely see a more endemic approach to the virus. Dr. Souza believes we're not quite there yet.
Will it fade into the background and truly become endemic? Perhaps. I sure hope so. Will a new, more infectious, more virulent variant be spawned in the next 8 to 12 weeks? It's a possibility.
Dr. Souza says that while cases have gone down, the threat of a new variant could be inevitable.
We have to stay wide awake. We have to stay vigilant. We have to support and continue our monitoring processes and detect the next variant.
Now, Dr. Souza did express immense gratitude for the state's healthcare workers, saying they've worked tirelessly during the pandemic. In the studio, Marcos Guadarrama, CBS 2 News.